Can you get pregnant with blocked tubes? How common is blocked fallopian tube is? And what is the treatment if you have a blocked tubes? How can you know that you have a blocked tubes? Hi everyone, welcome and welcome back in this YouTube channel. Let's get into the video and see what we have today. Hello guys, welcome and welcome back to this YouTube channel. If you're new here, please consider clicking the subscription button, and if you're a returning subscriber, thank you very much for always clicking in. And don't forget to like, share, comment, and also the most important thing, for you to get our video when we post, immediately we post them, kindly turn on the notification bell so that every time we post a video you'll get notified the first person. So we're going to answer this question that I was asked, and the question was, can you get pregnant if you have a blocked tube? The answer is yes and no, and I'm going to explain. So if your both fallopian tubes are blocked, it is very hard for the fertilization to take place along the fallopian tube, so you won't get pregnant without treatment. Yes, if you have two blocked tubes, you can't get pregnant without treatment. Is either you do IVF, that if you have not watched the previous video, I had already explained IVF very well, or you get treatment whereby you do surgery. You will be done for surgery to unblock the tube, and the risk of this tube getting blocked more is so high. So most of the gynecologists will not advise you to do the surgery to unblock the tube because they know the risk is also so high. So another thing is that if you have one tube blocked, you can get pregnant with the other tube. But if all these tubes are partially blocked, which means that part of the fallopian tube is blocked, you can get pregnant, yes, but the risk of getting ectopic pregnancy is high. If you don't know about ectopic pregnancy, go and watch the previous videos. I have already explained what is ectopic pregnancy. And so the risk of getting ectopic pregnancy is high when you have a partially blocked tube. Ectopic pregnancy, let me just explain a bit. Ectopic pregnancy is when pregnancy takes place and the fetus or the embryo get implanted not in the right place, not in the womb. It get implanted somewhere else, maybe in the ovary, maybe in the fallopian tube, maybe outside the uterus, maybe in the cervix. Yes, and most part, the most common part that ectopic pregnancy will always occur is the fallopian tube. So if you have a partially blocked tube, it's better you go and unblock it first, or you get treatment first before you get pregnant, so that you avoid getting ectopic pregnancy. Because you know, if you get an ectopic pregnancy, the pregnancy will have to be terminated, and also the fallopian tube will be cut off. So what are the causes of blocked fallopian tubes? Or people maybe are wondering, these tubes are just inside the uterus, yes, inside the pelvis, and why sometimes they get blocked even without any cause, without you have not done any pelvic surgery, and your tubes get blocked. We are going to look at those things that can make your tubes block even if you have not done any pelvic surgery. So I'm going to say that fallopian tubes are blocked by scar tissue or adhesion. This can be caused by many factors, and these factors include pelvic inflammatory diseases. Guys, I had already explained about all these pelvic inflammatory diseases. So if you don't know this, if you have not watched the previous video, go and watch the previous video so that you get to understand what is pelvic inflammatory diseases. Of course, there are diseases that can cause scarring and adhesion into your uterus if you get them and they don't get treated at the right time. So if you don't know about them, if you want to know more about them, kindly go and watch these pelvic inflammatory diseases videos that I did long back. The second point is that endometriosis. Endometrial tissues can build up in the fallopian tube and cause a blockage. So endometrial tissue on the outside of the other organ can also cause adhesion that can block the fallopian tube. The next point is if you have certain STIs such as chlamydia, gonorrhea can cause scarring and lead to pelvic inflammatory diseases. If you have fibroid can grow along the fallopian tube, and you know the fallopian tube is the size of spaghetti. So anything growing there can make it can block it. So if you have fibroids can be treated. Fibroid can be done, you can be done for surgery and they remove it, and then you just get pregnant. So fibroid is another cause of blocking tubes. Another one is past abdominal surgery. I said that most of the pelvic surgery usually cause the scarring and adhesion. So if you have done abdominal surgery, pelvic surgery, you can easily get a blocked tube. So you can prevent many causes of blocked fallopian tube. However, you cannot decrease the chances of STIs by using however, you can decrease your risk of getting STIs by using condoms during sex, so that you don't get pelvic inflammatory diseases, you don't get STI diseases. Yeah, that is what I can say about the causes and about the causes. So another thing that you have to know, if your fallopian tubes are blocked by a small amount of scars or adhesion, your doctor or your gynecologist can do a surgery to unblock it by opening the tubes. And remember, doing a surgery can also increase the risk of getting the tubes more blocked. So most of the time, the gynecologist usually discourage this. Okay, yes, so we are saying it is possible to get pregnant following treatment for blocked tubes, and your chances for getting pregnancy will depend on the treatment method and severity of the blocked tubes. Yes, if you have 2 tubes blocked, your chances of getting pregnant normally is a no, and so you have to get treatment first before you get treated. So how can you know that you have a blocked tubes? That is also another thing that we're gonna talk about. How will someone knows that you, of course I have a blocked tube, so I should go and get treatment, or I should go and see my gynecologist before it gets into worse phases. So many women doesn't know that they have blocked tubes, because most of the time you might get that they menstruate, especially if they have one tube is blocked, they will menstruate normally, they will go for all these reproductive phases normally, but we have some signs that will show that you have maybe 1 or 2 blocked tubes. So let us look at those. So we have signs that will show you or will make you go to see your gynecologist, and one is painful menstruation. If you usually have a severe painful menstruation, kindly go see your doctor. The next one is pain during sex. Pain during sex is also another sign. Heavy bleeding during menstruation, and also heavy bleeding in between the periods also can be a sign of blocked tubes. You can also have unusual vaginal discharge. Yeah, you can have unusual vaginal discharge, and at the same time you can have lower abdominal pain. Yes, you can have lower abdominal pain that is severe, and also infertility will set in, and this is one of the most thing that will make most of the women who have blocked tube to go to the hospital, because they will only realize that they are trying to get pregnant and they can't get pregnant, so they will seek an advice from the hospital. So that is the things, that signs and symptoms that will show if someone have blocked tubes. I think I'm going to stop from there, and our next video I'm going to talk about natural ways that are a bit scientifically proven. If your tubes are not severely blocked, you can try this and they can unblock the tubes. And most people also, I think most people who have who did not have severe blocked tube has testified about the positive result concerning using all these things that I'm going to talk about in the previous video. So stay tuned, make sure you watch this video up to the end, and if you have not subscribed, kindly subscribe, like the video, share, comment, and let's meet in the next video where we are going to talk about natural ways of treating blocked tubes. Bye till next time.